I feel like happy because I can meet new people.
Really good for mental health.
Just felt so relaxing.
I feel very happy and I feel like I'm in a zone where I can just calm down.
It's something to get up for and do.
It's good for my mental health.
It really makes me feel happy, actually. Adrenaline and endorphins going, always puts you on a bit of a high. I like it.
Enjoy the sun and like everything else and the nature and something like that.
When I do it some exercise, usually I feel better. I
feel really blessed. I think meeting and socialising with new people.
I feel like very happy and I feel more energetic. It overall gives me a lot of energy.
I feel happy.
We're delighted to share with you the impact that we've achieved together as a system to tackle inequalities and get more residents in Oxfordshire moving than ever before. In 2024 and 2025, we've reached well over 20,000 residents, facing the greatest barriers to activity. For the first time, we've been able to offer support across the whole life course, thanks to new funding for maternity and early years provision. In the year that Oxfordshire has become a Marmot place, we're working harder than ever to tackle our county's extreme health inequalities. We're working where the need is greatest to achieve the biggest impact for residents, and as always, our communities are in the lead when it comes to creating the change. Our community-led approach has been significantly boosted by Sport England's Place Universal Offer funding, which is set to create a real step change in how we work together to challenge systemic inequality and get more people active.
You Move and Move Together continue to create significant impact. We've seen hundreds of residents increase walking and wheeling thanks to active travel funding. And opening school facilities has transformed the way that schools across the county approach physical activity. We'd like to thank our main funders, Sport England, Oxfordshire County Council Public Health and BOB Integrated Care Board, as well as local city and district councils, Home Starts, Oxford Community Action, and the Active Partnerships national team for making this work possible. There is so much more to do to tackle Oxfordshire's extreme inequalities head on. But this past year has been a real celebration of what's possible when we work together and showcases the transformative impact of activity on our health and well-being.
It's well known that health services across the UK are facing unprecedented pressures. Physical activity is known as the miracle cure, a low-cost, highly effective preventative intervention that saves lives, prevents health conditions and reduces pressure on primary care. In 2023, a groundbreaking whole system approach to activity was developed to take a prevention-first approach to protecting health and well-being through activity. This whole system approach has already achieved significant national recognition, and we as a system were finalists in the 2024 Health Service Journal Awards.
As part of our whole systems approach to physical activity, we launched our place-based Physical Activity Clinical Champion Programme, an initiative that provides free clinician-to-clinician training for professionals working in healthcare. To date, over 900 healthcare professionals have been trained, with our evaluation demonstrating that 100% of participants reported feeling motivated, confident, and better equipped to promote physical activity to their patients.
As part of our ambition to extend our offering to the full life course, we expanded Move Together to include dedicated support to pre- and postnatal women for the first time. Expert-led guidance during pregnancy and early motherhood plays a vital role in helping mothers build healthy habits, positively influencing both them and their children through the benefits of physical activity.
We've had really good feedback from the mums who've attended the classes because they found that the sessions have been quite flexible. They've been able to meet other mums who are in the same position, felt they're confident enough to be able to go and exercise with other classes, not specifically postnatal, but be able to integrate into other classes locally and some of our buggy walks that are taking place as well.
In 24-25, You Move expanded to include support for under fives, working together with local councils and Oxfordshire Home Starts.
I think what's been really great about Home Starts collaboration with You Move has been the way in which we could partner with activators and providers of movement opportunities and bring those sessions into the groups and venues that we already have trusting relationships with families, with babies and toddlers. But we know that the period up until children starting school is the time when children's physical activity reaches their lifetime peaks, and we had some amazing feedback from families of how they wouldn't have been able to access that session without without us introducing it to them, often because of confidence, sometimes transport. But it helped really make it clear to them that it was a low-cost opportunity with the UMove card. So one of the families said that my girls have been up since 4 o'clock this morning because they've been so excited about coming here today. It's also the first time I felt comfortable to let them have a swim. They've been absolutely loving it. Another quote from a family was, "I've loved seeing my sons running everywhere. They haven't walked anywhere. It's been non-stop and they're exhausted." So you can just see how this is starting patterns of confidence or access to opportunities that they weren't taking up before. We've helped to overcome some of those barriers, and it's starting to embed some hopefully lasting habits.
So there's been lots of behaviour change through open school facilities. 3 that really spring to mind are those schools that have actually genuinely opened their facility to the community. So they now have spaces that are hubs of activity. We've seen lots of schools supporting activity for their SEND young people through sensory circuits particularly. We have about 20 schools now where that is their day-to-day activity for those young people to help them self-regulate. And we've seen huge improvements in behaviour and concentration. And then there's a number of schools who genuinely embedded activity throughout their school day. And we've seen some really interesting changes in behaviour through things like active school uniform that are making a real and long-lasting impact thanks to the funding of open school facilities.
In Oxfordshire, we see stark inequalities facing our youngest generations. A child born in Blackbird Leys will live 13 years less than a child born in the richest parts of the county. We are determined to level the playing field so that every child has the best possible active start in life. We now have an incredible 13,911 residents signed up to UMove across the county, which is almost 30% of all children on free school meals in Oxfordshire. We've seen exceptional increases in activity levels and also important decreases in both adults and children who were previously inactive.
In 2024 to 25, Move Together reached 1,932 residents. This includes many residents who were completely sedentary and who stand to gain the most from moving more. 80% of these residents increased their activity levels by 3,000 steps per day. We also know that Move Together participants sustain their activity even after the initial support comes to an end. Move Together continues to represent excellent value for money and reduces pressure on health services. Participants who received support from Move Together recorded a 22% reduction in 111 calls and 43% fewer GP appointments, contributing to an overall social value gain of 1.4 million.
There are a number of benefits, and first and the obvious one is the social side of it. As you've just seen, they take ages to leave because they come individuals and they seem to leave as a group. One lady who, first time I met her, she was walking with one of those stroller frames, and her ambition was to not have that. And she still does use it, but one day she just came in and walked across the floor without it. And another day she came without it at all, walked from home without it. So people do see benefits from it. And now most of them can stand on one leg for at least 10 seconds, which is a real predictor of longevity. So
yeah, we do enjoy it because it gives us time to meet each other, physically and mentally. It's very good. So that's quite nice. So we feel everything's being used and moved. It's quite important. When you're 90, we're 90. Yes.
We've supported clubs with safeguarding their club members and families, upskilling them in running inclusive sports sessions and raising awareness on different issues which may impact their club members and supporting them with this.
We've supported over 100 coaches, young leaders, volunteers and parents from over 15 clubs, schools and young leader programmes across Oxfordshire to create safer and more inclusive environments.
We've worked with the NWG and Stay Safe Global Charitable Trust to run trauma-informed coaching training and information sessions for parents.
And have also partnered with Access Sport to equip coaches in leading neurodivergence and disability inclusive sports sessions.
Our work has extended to neighbouring counties and nationally too. We have collaborated with other active partnerships to deliver sessions together, covering a range of topics including internet safety, GDPR, DBS and safer recruitment and bystander awareness, to coaches and to parents to better protect, support and safeguard Oxfordshire's children and young people in sport. For us, building safe and inclusive culture goes hand in hand with our journey to be actively anti-racist. We've been learning alongside Shaista Aziz and working with Hayley Bennett to bring anti-racism into how we work as a team and with our partners.
Work streams around anti-racism was really incredible to see, and it showcased the commitment that the organisation had to truly embedding anti-racism in how Active Oxfordshire works internally and externally as well. What has really stood out for me, setting quite an ambitious vision and not just looking at what similar kind of organisations are doing, but also looking more widely, which is where I think I came in as an external consultant. And what I have really seen as impactful from the work that the organisation has been doing has been how I've been able to actually showcase some of the progress that you've been making to others. So whether that would be the statement that was put out quite swiftly and meaningfully following the riots in August 2024, one of the very first sports organisations, if not maybe the first sport organisation to speak out and talk about how that might impact the community. As well, the recruitment policy, which was shared very transparently and tangibly, I've also used to showcase this as good practice, which has led to other organisations looking at how they can do something similar. So it's having that wider industry impact as well. It's just better ways of engaging with like local communities and designing programmes and interventions. A lot of people are fearful of talking about these topics with people within the community, so being able to engage through the events and having anti-racism as a topic that you've explored with the community is going to really actually shift how things are done and how we engage communities with these topics for the long run.
To achieve lasting change and support residents to get more active, it's vital that this is driven by communities in our priority areas. That's why we've worked harder than ever in partnership to gather crucial insights about local assets and challenges to being active. We've made our application process easier and more accessible for individuals and community groups applying for funding. This has unlocked the power to work more flexibly and closely with communities to hand over power and create long-lasting change.
Last year, we ran active neighbourhood scans in Banbury, Neathrock and Ruscott and opened up an ideas fund in Blackbird Leys so that local residents could lead on creating change. We had over 15 community-led projects apply to this fund from the local area, and projects included community gardens, allotments, litter-picking walking groups, with efforts to make local outdoor spaces more attractive and welcoming. Our Community Outreach Active Travel Fund continues to go from strength to strength, with over 1,000 people reached by our projects. With over 270 adults given access to inclusive cycling and over 80% of our funds spent on projects in our priority neighbourhoods, which has led to more than 50% of participants walking, wheeling or cycling more as a result of partaking.
It's been an exceptional year for Active Oxfordshire, our partners, and for the activity agenda. But this work has only been possible thanks to the hundreds of partners involved across the county. If you'd like to join us in our mission to tackle inequalities and increase activity levels, please visit Oxfordshire on the Move or speak to any member of the Active Oxfordshire team. Thank you.